tell Marty that. I know. She's in house on site. A lot of people. Told her I apologize. I'll get her. I forgot.
Oh, oh. Come on, Dr. Adam.
Come on up here.
Dr.
Yeah.
A, you've given up and like now you're just going with Dr. A?
Even in California.
Really?
Oh, yeah.
I like that.
So this is a half hour.
I like
Yeah,
Donna.
it's shorter.
I was going to go with the symbol formerly known as.
Come on over here and sit by me, Brian.
I'll sit by you. I'm not afraid. Eat it with the chopping down.
You've become too rash.
Carl, would you come over, please? Like, Chief Legal, you should be here.
Good.
That's proximity. It's too close.
Like having a lawyer in here. Doesn't like having
Did they tell you what I was saying about
We love you,
the
Carl.
first time
We love
we
you.
morning during your session?
No.
So you stood up. Hot mic.
Your bald spot.
You need to dust me down.
You got some makeup, guys?
Glare off my
Black for
forehead.
Brian's head. Brian's head.
Right. Lighting in your time. I mean, if anything, I'm worried that someone could die from my handsomeness.
Oh.
Right. Accident. Known to be lethal.
If you're involved in an accident, here's my card.
I'll leave some cards. I can get one of the Rush Legal polo.
I'll get you one.
Yeah?
Yeah. They're pretty sweet.
That's for the logo.
Yeah, he completely decimated the anchor cross. I'm sure Jones.
Yeah,
Nicely
some
done.
people said something. I don't care. Some people said that.
Oh, they did?
They added the bannons.
With the logo? No, they're. Yes. No,
It's not allowed.
Gandorf was like. Is that not what it?
I know. I'd like to know. Would you let me?
Get us started.
Good afternoon, everyone. Yeah, that's what I'm talking about. Hey. So, thank you guys for coming. We wanted to have an opportunity to give the organization, which is our people, all of you, the opportunity to ask questions. We know that over the last several weeks, you have been hearing a lot of questions. I've been hearing a lot of information about the CMS visit, and it's been more like a one-way communication, so we wanted to make sure we were able to give you an opportunity to ask questions. So we have a few people up here on the panel who will be answering questions and giving information. First of all, I'm Cynthia Barganier. I'm the Chief Operating Officer here at the hospital, and then I will let my panel partners up here introduce themselves, and then we will get started. You want to start, Dr. A?
Oh, sure. Hi, everyone. My name is Dr. Adabe, a.k.a. Dr. A. I'm our Chief Wellness Officer.
Hi, I'm Carl Burgetts. I'm the General Counsel.
Hi, everyone. Richa Gupta, Vice President, Ramji.
Hi, everyone. I'm Brian Stein. I'm the Associate Chief Medical Officer for Hospital Operations in Rumji.
So we're going to start this out by having Richa to give us a few tips around communication with the surveyors. It can be a little intimidating, I think, for people when they are talking to surveyors, and we want to make sure that people feel as comfortable as possible. So we're going to give you a few tips, but really and truly we want you to just be the excellent clinical and other employees across the organization that you always are. So this is only to give you tips to help you to feel comfortable in these conversations. So Rich is going to go over some of these tips, and then we will open this up for questions from the floor. Richa?
Absolutely. So, there's a lot of communication that's happened in the last 2 weeks. So I wanted to first of all just start off with why we're here and what to expect early next week. So we did have a complaint investigation by IDPH, which was late in March, and it was around an incident in behavioral health. They identified some gaps in how the environment that we provide care in, and that was the reason that we temporarily closed our behavioral health units and transferred our patients out. And that's really to expedite the renovations on those units so that they can be ligature resistant as soon as possible. The other piece around that is they had a few other issues with the documentation of the care that we provided, because of which they cited us on CMS conditions of participation around patient rights. So that really is the main focus of the survey. However, because of the fact that we have not had a full CMS survey in over 25 years, this is going to be a full CMS survey. So I know you all have been through many Joint Commission surveys here. I've had the privilege of leading the last three over the last 8 years here. And IDPH CMS survey is different, and here's how it's different. So first of all, we say CMS survey, but it's really conducted by state surveyors from IDPH. Unlike Joint Commission, where we usually get 7 to 8 surveyors for a 5 day period, this is going to be pretty intense. So it's going to be a 4 day period, most likely starting on Monday or no later than Tuesday, but Monday is our best bet at this. And it's going to be anywhere from 15 to 20 surveyors. So it's a pretty large survey team, and they do this so that they can really microscopically examine every part of the organization. About half the team will be clinical administrative surveyors, and the other half of the team will focus on life safety and environment of care. So their goal is really to get to every part of the organization that we provide clinical care in, and to walk every mile of this facility so that they can find, look at all of our look at how compliant we are and really find any issues and tell us. Unlike the Joint Commission, which tends to be a fairly collaborative, consultative type process, we get pretty chatty with the surveyors. This is more focused, a little more intense, and will not feel as friendly. So that's just something so that we can prepare ourselves, right, for what this survey feels like. So you all and your teams do an amazing job, first of all. And this is evidenced not just by our quality results and the care that you provide every day, but how well we have fared collectively in our last many surveys. There's not a survey I can think of that the surveyors don't leave here praising our staff. They can't stop talking about you all. They love you all. They actually, a number of them get their care here, so they're pretty biased, but their job is to find things, right? So that's the mode that they're in, and in surveyor mode, they're going to get pretty nitpicky about things. So overall, I would be in typical surveyor mode, which you all have been through many surveys, so you know what to expect, but really step that vigilance up even a little bit more on that topic. And what that entails is really keep your answer short and sweet. So they're going to ask you a specific question, answer to that point. There is no reason for us to get into any other rabbit holes or issues that they did not ask us about. One of the other, and there's a nice handout that the teams made here. One of the other specific questions is, they'll ask us, do you do this thing or not, right? Like, do you follow this process or not? Stay away from answers like, that is what we expect to do, or that's what our policy tells us to do. It's yes or no, right? Like, let's be honest about whether we do it or not. And that's what they expect. They expect 100%. Back in the day, we used to talk about 75%, 90% with Joint Commission. They're really about 100%, and so are we. So when we expect to do something, we're actually doing it. So answer that question as such. The other piece specifically to focus on is they may give us different guidance in Joint Commission as they have, including on the behavioral health units and the ligature risk. So Joint Commission found that acceptable, but they did not. Now, we don't want to bring up what the Joint Commission found or that this was acceptable by the Joint Commission. So keep away from any of that. It's really a fresh set of eyes in a way, and that's how we should treat it. So you should really answer the question. If they don't like what we're saying, there is no reason for any of us to get defensive about it. We're going to take that feedback and we're mostly going to correct that. Many of you know people or have been at other organizations that have been through this. It feels intense and somewhat grueling, but at the end of the day, this is about the amazing care that you all provide. So proudly represent that. And if there's any changes that we need to make in our spirit of continuous improvement, we want those suggestions. So we're going to take them, we're going to try our best to resolve them, and then put corrective action plans in place. So what to expect on Monday morning itself is typical surveyor notification protocol. So they'll come to our arrival desk. The command center that has been set up to respond to this over the last 2 weeks will be notified of their arrival. We will host them in 364, which is our executive suite, and then what you will see is surveyors coming out to your areas, right? So you'll see the typical sort of combination. Carl keeps reminding me that these guys could be off on their own, and that's a true statement. They could pull you aside, ask you a question, but we're going to try our very best to have an escort, survey escort, and a survey scribe with them at all times. The scribes will wear rush green T-shirts, so you know who they are, and then we're just we're a little more attentive than usual because they're around us. One other piece that I'll just add from a things to watch out for survey etiquette for next week is we sometimes are in elevators, and I know all of us have heard this. Someone else talking about the rough day that they've had, the staffing that they don't have on their unit. I would really keep this talk to really eliminate this talk for the next week. So if you have any issues, please do escalate them to your leadership teams or to any of us. That's really what we're here for. But there's no reason for us to be talking about those issues in common spaces, particularly in elevators where you're likely traveling with a surveyor next week because of the number of surveyors we have. So that's just a high level overview of the survey and what to expect.
So we know that all of you have been engaged in a lot of work over the last couple of weeks, and we really want to first and foremost say thank you for all of that. But it also may have brought up a few questions that you may have about changes in systems and changes in process because we've made a few changes in process where we've seen opportunities for improvement. We've tried to make some of those changes as quickly as possible. So you may have questions about that, or you may have questions about what to expect in the survey. You may have questions about where Richard got this really cute dress, because I wanted to know that. Whatever questions you have, please feel free to step up to the microphone. We are doing a WebEx, so if you have a question, if you would step up to the microphone, that would be really helpful for those who are also listening. Yes.
Hello, thanks for this opportunity to ask questions. So I'm the nurse manager in two clinics, the ID clinic and the pre-op clinic. And in the ID clinic, you all know we do a lot of research. And so there's been so many questions about, are they going to look into our research supplies or paperwork? And we all know that's very different than the rush standard. And so we're just wondering if they have a right to look into research stuff or not, because I
Yes.
don't know.
So before Carl corrects me, they have a right to do anything, right, Carl, as you always say. But the scope of the survey is not research. So the
Mhm.
scope of the survey is clinical care, not research, not university. However, there are still some things that they could chance upon because you may have a patient there. So then consents come into play. They might want to observe a consent being administered. I believe the research leadership has sent out some communication on informed consent process specifically because there was some clarification around that. I heard that yesterday. And then the other piece specifically in your clinic is making sure that the clinical supplies and medications are separate from research supplies and medications, which I believe they are.
Oh,
Right?
yes, they are.
Yeah.
Yeah.
And pay attention to expiration dates
Yeah.
and the kinds of just the normal kinds of things that you do from a process and infection control perspective. They may be looking at those things, but we don't expect them to dive deep on research specifically.
But obviously, if they ask to go in a cabinet that's marked research only supplies, we're letting them go. And
Yeah, we'll
Yeah.
try our best to manage it. We're not going to get, obviously we're not going to get into it with them, but we're going to say that that's scope, that's research only, and that's not where we keep clinical information.
right. My other question is also in the ID clinic. We have all the doctors and staff have their office separate from the clinic, and everyone's wondering if they're going to go in the office.
They're not. Again, Carl will probably correct me, but they're not. We're not going to walk them through administrative spaces. Now, the life safety environment of care people will walk through those spaces, likely through every space, right? Because there's just so many of them, and that's typical for surveys. But the clinical surveyors have no reason to go back there.
So if there's a life safety officer, then is it kind of the similar scenario? They could ask questions, or they're just doing an environmental check,
Walk
or
through, tool belt walk through.
oh, okay.
Yeah.
But that's where things, even in your office space, so where you should have food, you should have food. Where you should not have food, you should not have food. I mean, those kinds of things, because they will be looking for that kind of thing. If you know that you have ceiling tile that have wet stains or something like that, go ahead and report those kinds of things, because those are the kinds of things that the life safety. If you have doors that are supposed to shut that don't shut, report those kinds of things, because those are the kinds of things that they may be looking for from a life safety perspective. No door stops that shouldn't have door stops. The same environmental things that you would do in any clinical area. I think it's important to do everywhere because they could go anywhere.
I've also been
Right.
telling people with that same question, if you have something in that area that you think should not be there, to get it out
Mhm.
from that perspective.
Right.
Just because there will be surveyors coming through, and they might be looking at life safety, but if there's something and they're not going to go into uh, clinical aspects back there, but you're still going to have an IDPH surveyor potentially walking through those administrative spaces.
Well, in that back there, we don't have like a break area, so everyone eats at their desk. So I guess.
It's not a patient care area,
That's
so it
fine.
should be
Right.
fine.
Yeah.
Fine.
So then there's
Yeah.
food in everyone's desk and
Yeah.
drinks everywhere. So.
As long as um, there's not patient contact and it doesn't come in.
No.
Yeah, that should be fine.
Okay.
Not to correct Richa, and I'm not. I'm just adding to it. She's right that deep. It's what is their right and are they likely to do. They're the state and they have police powers, so they are able to look at whatever they want to. What they're here for, though, is inpatient hospital survey. So it's highly unlikely. But what I've told people in the morning meeting is sort of we should just all presume that they could be anywhere. They're unlikely to, so we shouldn't be unnecessarily like anxious about it, but we should just presume that they could be anywhere. And so for that reason, as Rich has said before, if we're in common areas, good idea not to talk about the worst possible things that are going on in our lives at that moment. Good idea, even though they are unlikely to come and go in those spaces that you're at, to have them in as good a shape as you can make them, and just have just be on our best behavior is the best way to look at it. All of us, and we always are. We like to say, but let's being honest. They're here. It's really important to ramp it up as much as possible. Highly unlikely that they're going to go into these areas. And also, from one other thing I wanted to say is, if they go down that kind of a rabbit hole,
Mhm.
make sure that you communicate to the escort that's there, the incident command, or to your departmental leader. And we're going to make sure that everybody has sort of the directory of Richa, number, team, email. All the escorts will have the escorts that are going to be taking these people everywhere, so that you can communicate, it turns out we want to have a constant feedback loop going on all 4 days. So if they do go to this particular place, through chain of command, let incident command through Richa know about it, because that'll inform us, number one. It'll help us guide it the next step of the way. Also, if they're doing something where, in my view, or the clinical or legal view, that they shouldn't be, it'll allow us to react to that. We don't want to be antagonistic with them in the moment, but we are free to, and we should be reporting back to incident command what they are doing, so that we're able to react to it properly. Okay?
Okay.
The other piece too, and just to clarify, when we say hospital survey, we mean hospital and clinic. So it's the inpatient and then any clinic that is under the hospital license as well. So provider-based clinics, which is ID.
Right. Thank you.
Thank you.
Hi there. My question is about the private clinics that are here in this building. Will the surveyors possibly go into any of those, and will there be any notification just for those folks in case they see people walking around? I don't think there has been any communication with them at this point.
Again, they will not likely, and they shouldn't, but we'll definitely put notification out about that. And if we see them, if our team is seeing that happening, again, it'll come back to incident command, and we'll be able to both communicate it out and also react in real time to what they're doing.
Okay.
And when they show up, whatever day they show up, whatever time they show up, we will send out communication to everyone that they're here, and kind of some tips about things that people can do to start preparing their environment. So no one will be left in the dark when
But
they get here.
the privates don't get the all rush. Like I was speaking to my Dr. Katz, who's on the third floor right by the executive suite, and they knew nothing about it. And since they're so close,
That's
I
a
was a
good
little
point.
worried.
No,
I
that's
said,
a
don't you get the all rush emails? And they said, no.
Okay, well, we need to
So-
that's very good feedback. Thank you,
Sure,
Elizabeth.
okay.
We'll make sure that we get some notification to everyone, because everyone needs to be aware that
Right.
they're in the building wherever they are working, even if they don't come into your space. We want to make sure everyone knows. So thank you for that.
Okay.
Thanks.
Thank
And
you.
Rich and I were talking about this earlier, that everybody on the third floor in the POV building will be on notice about the fact that they will be here and that there'll be trafficking. There is a path that Rich has worked out and the others have worked out to get them from point A to point B, but they will be passing, groups like that, and we want to make sure everybody's both on notice and, again, treating it as if, best behavior kind of situation.
So one other piece that I got reminded of, and Cynthia said that about informing you that they're coming to your area. So we will do our best to continue to use our joint commission methodology, which is we call you, we text you if we have your cell phone numbers, and that way you know that they're heading to your area. We don't get the same amount of notification as we typically get with the joint commission survey. With joint commission, they'll usually tell you in the morning, we're going to these 4 areas. We don't get that kind of notification. But as soon as we know that we're heading to your area through the command center, we will notify you.
Other questions?
So I work in the administrative part of the emergency department, and so, we're in one building, the ER is in another, but from time to time, we have to go through the room to go over to the ED staff. And so, I mean, if they would stop and ask me a question about how the emergency room operates, I would know some stuff. I would probably point them to the charge nurse or something like that. But I mean, if they ask me, I mean, would it be legitimate to say, I work in admin.
Yes,
do that.
absolutely.
I don't
And
do that.
make sure that they know you can talk about what your role is, and you can always say I don't know. And any question that they ask you that you don't know the answer to, you should feel very comfortable saying I don't know. If I needed to have that information, this is who I would ask. So you make sure that they recognize that you know how to find the information, or this is where I would look for the information if it's a policy or something of that nature. But that goes for any of you. If they ask you a question and you don't know the answer, it doesn't benefit you or the organization to feel like you have to give them an answer. So just say no.
The other thing I would say is even more important than the elevators, watch what you say in bathrooms.
Yes.
A really good point.
Good point.
It's unlikely the escorts will be accompanying them there. So that's a good point. But as Cynthia was saying, if you look up at bullet point number 4 up there, if you're unsure, and this is as counsel is, please, like I always tell people, just answer the questions put to you, and if you don't know, don't speculate. A perfectly acceptable answer is, I don't know, but let me get you that information, or let me direct you to a person who does. And one of the other things is that requests for information, documentation, and things like that might come into you, if you're not the right person to get it, you'll feed that information to the chain of command that'll go to incident command, and that's perfectly acceptable for us then, Rich's team, then to provide it to them. And so that should give you guys, I mean, as on our toes as we want to be and somewhat anxious as this is all anxiety producing, this is all creating, we should be confident about it. It's easy to say that, but we should feel very comfortable that we do good work here. Rich's team, Brian and Omar's team, they're on it. The war rooms are, well staffed. People are going to be able to answer the questions. We will have answers for everyone. Even if you in the moment don't have the answer, we can get it, and you should be confident about that. And what I said this morning earlier was, we do such good work here, and including in the behavioral health unit where it was, that what we just want to do is prove to them that we do that, show how good we are, so that we can get back to providing the care that we do provide. I said earlier today that our mediocre days are better than a lot of people's best days. And it's an unmitigated good that Rush is here and that our units are open, and they should be open. But out of an overabundance of caution, that was rational and prudent. We did shut it down temporarily to accelerate those improvements and that remediation, and that's okay, and that's what we should have done. But at the end of the day, we're still an incredible institution that is here to provide very important health care for people. And the Joint Commission, excuse me, Never say that. The Department of Public Health and CMS know that. Yeah, I know exactly. There is, as we've indicated, there's some tension between DPH, CMS, and the accrediting bodies, and that's why we don't want to ever say, well, Joint Commission said that. But anyway, you know, they know that. We just need to show that and show that with confidence. And where we don't know, route it to the team, and they'll get the right answer to them. And in 4 days, you know, we will be in a good position to get back to what we need to be doing.
That's a really important segue for the other reason why we pulled this group together and wanted to be able to thank all of you. So there is just so much work that has gone in, not just every day that you provide care and your teams are out there doing just amazing, incredible things that we are known for. But in the last 2 weeks, you all have moved mountains to really address some of the documentation pieces, really just tightening up some of the pieces that we can really showcase the great care that we provide. So we really want to thank you for that. It's just incredible to see how much we've done in the last 2 weeks, and we feel really confident that we're going to shine through this. We know the goal of this survey and the goal of CMS, by the way, is to keep us open, right? So this is really the goal. But they do have an obligation to really look at what opportunities there are and provide them to us. So there will be things that'll come up, but we know that we're really going to get this together. And as the nursing team here always says, this is just a great rush proud moment.
Well, speaking about the hard work that everyone has done, one of the things that we also want to remind you about is taking care of yourself, because that is as important as taking care of the patients uh, and your coworkers. So, Dr. A we're very lucky to have him here, our chief wellness officer, and he has been really working to make sure that we are providing some opportunities for self-care across the organization. So I would invite Dr. A to say a few words
Absolutely.
about the work that we've been doing. And
Yeah, I want to start again by just echoing the sentiments that we've heard and thanking so many of you that have done just an incredible job, particularly over the last few weeks. Um, we recognize the amount of stress and tension that has existed as a result of preparing for CMS, and so we wanted to, on this last Friday, offer some nice concessions. On your way in, you may have noticed we have set up a stat massage consultation, and we recognize that chair massages aren't going to solve all of our problems, but it's a nice touch, and it's a nice way for us to recognize the hard work that you've done. And so we're going to have that massage room set up really through the rest of the day. We also, my team and I have been making what we call wellness rounds through the tower and the atrium. And so if there are units or places where you feel that there's high stress, where folks are tense, or where you think you might need a wellness consult, you can reach out to us, and we've actually been deploying these massage therapists to different floors. And so if you can think of a place where you think our services might be needed, I'm going to refer you to my new project coordinator in the back. She's got her hand up, Decca. Only person in the rush system with that name, so she's really easy to find, and it's DEQA. After our session this morning, she pulled me aside and said, Dr. Ray, my email inbox has been flooded. I said, that's what comes with it. All things aside, one last thing I'll note for next week is it's normal to feel tension or anxiety or maybe even a certain amount of stress, right, when the surveyors are here and when you may be called on to answer questions. My little piece of advice, first, is everything that Carl and Richa and Cynthia have said I completely agree with, but just one cognizant piece from a self-care standpoint is just take the time to breathe. We know we do great work. You know what you do. Take a moment to just focus on your breath. Take a deep breath and answer intuitively, and as I'm sure you'll do well. And so we'll provide these services for the rest of the day. And if there's anything else that we can do, feel free to reach out. Thank you.
so we're coming to the end of the hour, but I do want to just ask one more time, are there any other questions in the room that we can answer? Yes.
Question regarding storage areas. Would they be going through our storage areas where we may keep supplies?
Yes.
Yeah, they will?
Yes.
Definitely.
Okay,
Yes.
thank you.
Yes.
They will, and not just keeping your supply closets neat, but making sure you remember the rules about making sure nothing's on the floor, that you don't have you have an impenetrable shelf at the bottom, that things aren't more than 18 inches to the ceiling, all of those things that are really important, making sure that there are no expired supplies. And so looking at the things, not everything has an expiration date, so sometimes we forget to look at some of the supplies to make sure that they haven't expired. So and our people, Jeremy Strong is the vice president for supply chain. He and his colleagues are roaming all over the hospital, but you can always reach out to them if you have questions, if you want them to look at your closet and give you some consultation about things that you could do to um, spiff it up a bit and to make sure you're meeting the standards. They would be happy to send someone up to look. So feel free to reach out. Jeremy Strong. Is Jeremy? He's not in here. I saw him outside earlier, but Jeremy Strong. Yeah, and Quincy Stanley. Either of them, you can reach out to them via email.
Kind of along
Good
those
question.
same lines, our office is right off the unit. Is our office accessible to the surveyors? It's a group of APPs. There's no patient care material or supplies stored in there.
Is this in an inpatient unit or?
Yes, we are off the unit that we're in the like in the staff corridor.
I would just make sure that it's neat and that you don't have, if you have patient information, for example, that you can make sure it's secured and that no one could walk in and see.
We keep it locked at all times.
Yeah.
Our office locked at all times.
Yeah, that will be important to make sure. Those are the kinds of things I think that would be important for that kind of space. But then again, keep in mind that it is a part of the physical plant. So no door stops, no unapproved fans or heaters, no unapproved electrical cords or extension cords, those kinds of things.
Space heaters.
Yeah, I said heaters.
Oh, yeah,
Fans and heaters. Just making sure those kinds of things aren't there as well. I mean, because they could, from a physical plant standpoint, stick their head in your office. I mean, like Carl said, it may not be a probability, but it's certainly a possibility.
Okay. We're not going to walk them into the offstage areas, but if they choose to go there, they will.
So, that brings up a good point, and this is for all of you. Thanks for bringing that up. Is power strips in general are an issue for us, and we have a series of unapproved power strips here. The only ones that are actually permitted, this is a bit of a hotspot for IDPH, so the only ones that are permitted are the MCE approved ones. So if you have a power strip that you go back and identify in your space today, clinical or administrative, for next week, try to contact MCE to pull it out. Otherwise, if they're not able to get to you, please just pull it out anyways. It's best to just not have it on there.
And there are no approved heaters. So if you've got a heater, you need to take it home today because there are no approved space heaters. All right. So no other questions? Because we want to make sure we answer the questions that you have. That's really the whole point of this. And again, I just want to say thank you to all of you. We are an exceptional organization. The billboards that are up about relative to our excellence are absolutely true. The reason that they're up is because that is who we are. And all we want you to do is just demonstrate that to the surveyors. Feel comfortable saying what you do and being confident about that, because they want to know that we deliver quality care, and that's really their mission, to make sure that patients are safe and that organizations are delivering high quality care. And there are very few people who do that better than you do. So feel comfortable telling them about that. And we as Richa says, we got this. So thank you all so much. All right.
I got 3 space heaters and 2 medical that are signed off on my.
The space heaters? Yeah, there are two.
Yeah, no.
Oh, really?
No, we don't want.
Take them home.
Yeah.
They're huge.
Hi.
Yeah,
They're like the big ones on wheels.
Life change. No, I was all beats using those exact things.
And they have the MC.
Did it have the MC?
Those were my go-to, and they fell off and broke.
Oh, okay.
I would. So the one that you have in your office, it has the MC sticker, right? If